Good day to you, friends. My name is Chelsey. I am a breast cancer survivor, and I created this channel to add a little bit of a personal touch to some of the questions that I had when I was going through treatment, as well as sharing some of my experiences with the goal of taking away some of those unknowns for you as you're going through your breast cancer treatment. So today I'm going to talk about what it feels like to have your drains removed after surgery. So I had 2 drains placed for my surgery. I had 2 go in on the side under my arm here. One went to the top of the mastectomy site, and 1 drain went under on the bottom of the mastectomy area. And I really had no idea what to expect for the removal. I didn't really look it up at all. I didn't think it was going to be a big deal. In my mind, I envisioned the drains to be, about an inch long. So I went into this appointment and I thought it would be quick and painful. So the first thing that my doctor needed to do, my surgeon needed to do, was, remove the bandages that had been covering up my mastectomy site. And the drains were attached to my body somehow. If they weren't attached, then, the tubes would slip out, and that kind of defeats the purpose of having the drain there to help remove the fluid. So they were attached. I'm thinking it was with some sort of suture, some sort of stitch into the skin somehow. I couldn't see it. I didn't ask the question, but I know to begin the process of removing the drain, what she had to do was pull it out of my body a little bit. My husband said it was about half an inch, and cut the suture to allow, for the removal of the drain. So this for me was a little bit of a painful process. The scar tissue, the skin was starting to heal around the tube, the incision was starting to heal. So to disrupt it and pull it out, that process for me was a little bit painful. But as I mentioned, it was pretty quick. So she pulled it out, she cut the stitch and left it. She did the same thing for the lower one, gave it a quick pull, cut, and left it. And I was like, okay, almost there. That's going to be the worst part. I had absolutely no idea what was going to happen next. So as I mentioned, I really thought that the drains were about an inch long. I don't know why I thought that. It just made the most sense to me. It just goes in, it collects the fluid, and it helps you bring them out. But as I mentioned earlier, they weren't just an inch. They were, coming from my side, coming all the way over and on top of the mastectomy site here. So 5-6 inches. And then the same coming from the bottom, and you can't really see, but coming under my breast here to collect the fluids. I'm going to measure this after this and put a little tag on there how long that actually is. So there was a lot of tube drain to come out. So I was just sitting there, and my surgeon says, "Are you ready?" And I said, "Yeah, I'm ready." And so she goes, "Okay." So she had hold of both of these tubes that were, connected to the drains, and she just goes, whoosh. And I tell you, it was not painful. It was just a very gross, disgusting feeling. I don't know what it was. I think maybe it was just because I didn't expect it. It felt like these tubes were like meters long. It felt like there was a tube coming all the way from my toes and being pulled out. It just seemed like it lasted forever. it was such an odd feeling. I wish I could describe it better for you, but for me, that process was, it was more unexpected than painful. It was more just like a weird, just like almost like tummy dropping, gross feeling than painful. And I didn't really get a good look at them because she kind of got rid of them right away. But my husband said it looked just as gross as it probably felt. So yeah, after that, I think that she just did one of those little suture tape and taped up the incision site because they were just very, very small kind of like cuts in the skin. So I didn't need to stitch that up after. They just taped it really well for it to heal together, which was really nice. And then I was out and on my merry way, and it was, yeah, it was a great feeling. I mean, obviously moving forward from that, not having the drains, you know, not having to worry about sleeping with them, pulling on them, it was such a great feeling. But that appointment for me was just very, very unexpected. So I wanted to share that with you. So I hope this video today has been helpful for you. I welcome you to subscribe to this channel as I'll continue to share experiences from my breast cancer treatment journey, as well as my journey moving forward as a breast cancer survivor. So thank you for being here with me. I hope you have the most wonderful day, and take care. We'll see you next time.